So as we talked about, you said you're having some nipple pain with nursing as well as some engorgement and some blocked ducts. So I'm concerned that we're not getting good emptying of that breast. So I'd like to observe a breastfeeding session to see if there's anything we can do to help improve her feeding.
Yeah. Did you want me to nurse on the right
Why
first?
don't you show me what you're doing at home?
Sure. Okay.
Do you use a pillow or what do you do?
No, I just kind of latch her on. She
Okay.
usually holds on to the nipple pretty well.
All right, show me.
Okay, so let's see. Just gonna do on the right first.
Okay.
Okay, baby. Show us what you can do. So usually I just kind of hold her down here and I just kind of let her, I wait for her mouth to open and then I just kind of like that basically.
Okay.
So like you can see that the whole nipple is basically in her mouth.
Okay.
And then we just kind of hang out for like 5 minutes or so and do this.
Okay. Does your back start to hurt because you're leaning forward?
Yeah, I have noticed that, but I'm not really sure what else to do because her like head is so wobbly.
Okay.
So this is one way I've found that I can really kind of hold on to her well.
Okay.
I'm gonna try unlatching her.
Unlatch her, yep.
Yeah.
And have you tried the other, what we call cross-cradle position? Have you ever tried that?
No, I'm not really sure how to do that.
Okay.
No one really taught me that.
Okay.
Am I doing it wrong?
I've got some ideas that might help. Definitely have you feel more relaxed and more comfortable.
That'd be great.
And have her get deeper
Yeah,
latch.
let's try that.
Okay. Why don't we try a pillow?
Okay. I don't have one of these at home.
So you do not have to have this brand, although it is a nice brand. But there are lots of different breastfeeding pillows on the market. You also can just use regular pillows. You don't have to go out and buy anything special.
Okay.
But it is a good idea to have something that supports the baby because, as you noticed, you were hunched over and holding the baby.
Yeah, and my
as she
neck
gets
is
bigger and
killing me.
heavier, it can be burdensome.
Okay.
We're going to go ahead and try a cross-cradle position, which means we're going to turn her this way.
Okay.
And
does she need to be dressed for this, or?
Actually, ideally, we have her in a diaper.
Okay.
Babies
I just
really
changed her diaper, so we could try that.
They ideally like to be skin to skin with you and just feel that closeness and that bond. So we can keep her in a diaper. It's fine.
Okay, baby, let's try this.
And then babies like to feel very secure and they don't like to feel like they're falling. So having this good pillow here to support her, and I can even grab another pillow to put underneath if we need it, that can really help support her and keep her feeling secure and take some of the weight off of you and allow you to sit back. So you feeling more comfortable?
Yeah, I feel. I'll be relaxed as soon as she latches well.
Okay. All right. So now that we have you and her in a good position, that's a perfect handhold the way you have it.
Okay.
You're really supporting her in her head, and then you can actually have that free hand now to support your breast.
Okay.
And what we ideally want to do is we actually want to get her lips. You've said she's doing a good job of getting around the nipple, but we actually would ideally like to have her up here even past the nipple.
Oh, why is that?
Because that's where she's going to have the best success at expressing milk from you.
Okay.
And also it's not going to hurt you as much.
Yeah, I do feel a pinch every time she
so
latches.
when she compresses the nipple.
Yeah, that hurts.
That hurts you.
Yeah.
And it also basically closes down the milk ducts and prevents her from getting milk.
Okay, yeah, that's why she's probably so frustrated.
Yeah, so when she's up here, you might have some tenderness, but generally it's not going to hurt as much, and she's going to get better milk expression from you.
Yeah, I can see a couple drops already forming.
Yes. So the way you're going to do that is you want to look at her mouth and you want to compress your breast tissue and almost pull it back a little bit into a shape that matches. The nipple is going to be protruding, and it's going to be easier for her to get her mouth up and around and onto the nipple.
Oh, she's still pulling on the nipple.
Okay, so unlatch her. Don't let her hurt you. And what we're going to do is we're going to pull back again. And we're going to try to wait till she opens really wide, and then we're going to bring her up onto your breast.
Oh, wow. That's totally different.
That's better.
Yeah, that's a lot better.
Yep.
And I just kind of hold it.
And then once she's on there and she's got a good latch established, then you can relax a little bit.
Okay.
Yeah.
Okay.
But when you're latching her on, it's really good to use both hands and really make sure that you get a good deep latch, though, that it doesn't hurt you, and so that she takes milk more effectively.
Yeah, that doesn't hurt at all.
Mm-hmm.
Wow, that's really cool. Thank you.
You're welcome.